We've all been to the doctor, and when they take that little white light and they shine it in our eyes, and with this I can see everybody out there, so that's pretty cool, and they shine it in your eyes, and you may wonder, what in the world are they looking for? There's actually a series of several things they're finding. This is what the retina looks like. It's the back of your eye. That's really where your vision starts. This is a healthy retina. And what those doctors are looking for is a range of not only vascular diseases, these could be artery diseases, vein diseases, but they're also looking for brain diseases because the retina is actually part of your brain. This is actually some examples of those diseases that they will find. Because the eye is actually the only place where you can see these vascular diseases without an incision. So you can find ophthalmic diseases such as glaucoma, macular degeneration, diabetes, hypertension. There's just a whole range. And here's how they're integrated. You may think that these are independent diseases. They actually aren't. You may have, for instance, diabetes. That is a high risk for a whole cascade of diseases, including kidney disease, macular degeneration, stroke risk, heart disease. They all fit together. And you look at this graph and you say, okay, why are we not able to have this done on a routine basis when we go to our primary care doctor? Why isn't a retina scan mandatory for everyone over an age of, let's say, 40? And here's the main reason. It's not that they aren't taken. We are already taking, just in the United States, over 2 billion images. Unfortunately, less than 15% of them are actually even evaluated. And those that are evaluated, depending on the disease, you can have what's called a false negative as high as 40%. So from physician 1 to physician 2, you will have as much as 40% error between the two. What we've done at Oqulus is really try and do something different. We're using the same fundus photographs. That's the important thing. No new equipment, but what we've identified is a software cloud-based system that takes these images. They're immediately sent to the cloud. It's on the Azure cloud, Microsoft Azure cloud. We then segment out all the vessels, arteries and veins, and we put it through a proprietary software. This is software that, again, is cloud-based. It's developed with the University of Florida in conjunction with them, and it's all automated. Literally within a matter of seconds, we can give you these biomarkers specific to a range of diseases so that you can have highly accurate, quantifiable, whether this image is taken in Singapore or Seattle, you're going to get the same result. Here's the type of image that you will get. If you're a physician, you'll want to see all of this image. These are the types of diseases we're looking at now. Glaucoma, hypertension, diabetic retinopathy, and vein occlusion. We'll give you biomarkers instantly for that so that you can assess the risk of your particular patient. Here's the team that's been working on this. Myself, I have over 25 years of ophthalmic research with Allergan, Alcon, and Novartis. Randy, he has over 20 years in the health insurance arena. And Marshall, he has been in software development for over 20 years. And the team down in Florida, you can see we have them from the engineering school where the software applications were developed and the ophthalmology school. But there's a whole series of very excellent collaborators, even here in Dallas with the Retina Foundation of the Southwest and Johns Hopkins University. Our target market is really important for us because we felt that we really needed to go after self-insured employers because that's really a big market and it's a market that we can penetrate. There's over 87 million employees in that market, and we've identified the key segment, which is 50 million people who are covered under company health plans. And the way we break that out and want to monetize that is, remarkably, all of those 50 million people are covered and managed by just 450 third-party administration groups. So that gives us tremendous leverage. Every one of those third-party administrators we bring on board is equivalent to 110,000 employees. So here's the business model that we're following. We've already identified in 2016 8 of these health plans. They're shown here. It amounts to 3 million people. Just from demographic information, we already know 1.2 million of those people are high risk for diabetes. for hypertension and obesity. And from those 1.2 million, they're already pre-authorized to be able to get fundus photographs at least once a year, valued at $100 each, that we would do through the Oqulus system, making just that market size for these 8 groups $120 million. And that doesn't include the 442 that are not included. And so we start off modestly that next year, 2017, with $1 million growth, and over 4 years getting up close to $90 million. Here's what we've done so far with the $80,000 that we've raised, is that we have, with that $800,000, we've been able to validate 3 different biomarkers that include diabetic retinopathy, glaucoma, and also hypertension. We're raising an additional $750,000 that will be used for commercialization. Why Oqulus? It really benefits 3 groups: patients, payer, and provider, shown here. And really, the important thing here is that the eyes have it. We believe that with the Oqulus system, it is now going to give you the ability to screen all of these diseases and now bring that power to everybody who needs the treatment of retinal scanning. Thank you.